So at this point, you've probably heard a lot about the magic weight loss injections that have gotten really popular over the last year. But today, I've decided to share my thoughts. From 2022 to 2023, researchers documented about a 133% increase in patients prescribed these drugs and about a 26% decrease in patients undergoing bariatric surgery. Both can be very effective and helpful tools for people that have struggled with traditional diet and exercise, but as you can expect, there's not a magic solution that works for everyone. So the main difference between them in my mind has to do with your weight loss goals. Without question, bariatric surgery is generally more effective than the injections on the market currently. Patients can lose around 60 to 90% of their excess weight depending on which surgery they get. And with the current medications, we're seeing about half that at best. Certain people have had great success and lose above average amounts on these drugs. But these rock stars are the exception, not the rule. Next thing is about quick fixes. In short, there are none. Both medication and surgery require a long-term commitment to a healthy lifestyle, and you can absolutely still gain or at least not lose weight with both options if you aren't committed to these changes and take them seriously. Even with the injections, you need to consider them lifelong because there's a 20 to 60% weight regain associated with stopping the medications. So I'll take this for a few weeks, get some few pounds off, isn't exactly how this works. And now, before y'all start calling me biased, since I am a surgeon, I also specialize in medical weight loss and have many patients that are on these medications that are great options for them. These are patients with a BMI from 27 to 34 or up to 39 without an associated medical problem that's related to their weight and that also have coverage for medications with their insurance. That brings me to my next point, which is cost. If you don't have coverage for these medications, they can be between $500 and $1,000 per month. And since these medications are long-term, that can add up very quickly and be cripplingly expensive. In that case, even out-of-pocket surgery, which can be between $10 and $30K, would be cheaper than signing up for a medication at that cost long-term. And finally, a question I get a lot is, do you have to choose? And the answer is no. You actually can do both. Just because you had surgery or want to have surgery doesn't mean you can't use these medications. So which one is right for you? Ultimately, that's a decision to make with your bariatric surgeon or obesity medicine specialist. If you're in DFW, I'm happy to see you as a consult. If not, then I encourage you to find someone in your area that specializes in this and go in with an open mind so you can start on the right path on your health journey. As always, remember to like and follow for all things bariatric surgery.